Tranexamic acid, or TXA, has lots of uses in the medical world. It can be given orally, IM, IV, can be used topically, but in the pre-hospital setting, we're most commonly using this IV for patients that are suspected to have internal hemorrhage and hemorrhagic shock in the setting of trauma specifically. So these are patients that have signs of hemorrhagic shock, to include hypotension or hypoperfusion for their age, tachycardia, and then a mechanism that would indicate internal bleeding. So TXA does not actually help patients clot, but it helps prevent the breakdown of clots. Those two systems are always happening in our body at the same time. So this will stop the natural breakdown of clots, allowing the body to stop bleeding faster. So typical dosing is 1 to 2 grams. The older dosing was 1 gram, followed by a 1 gram infusion, which still exists in many areas. It's still listed in your pharma manual, but more and more localities are starting to go towards the 2 gram slow IV push. It was previously believed that that may cause hypotension, and there is still some anecdotal evidence that that may be the case, but lots of agencies have gone to the 2 gram slow IV push, so just follow your protocol. But a safe bet is always going to be to mix that in a 100 ml bag and run it in nice and slow. It has been studied in head injuries as well, so you can certainly use it in a patient that has internal bleeding plus a head injury. However, we're probably not at the place where it makes the most sense to give it specifically for head injuries at this time. But if you have a multi-system trauma patient with a TBI plus signs of internal bleeding, certainly kosher to go ahead and give it. We want to give it within 3 hours of injury. That's super important. So within 3 hours of injury, there's really no significant negative side effects of giving TXA, but if we give it outside that window, that's when some complications can occur. As far as GI bleeds, I don't believe that's specifically addressed in your pharmacology manual, but based on the literature that we have right now, TXA is not indicated in GI bleeds. It has not been shown to improve outcomes and could potentially worsen them. You can check out the HALT-IT, H-A-L-T-I-T trial for more information on that. That being said, I think moving forward, when we get a little bit more specific research, those indications might change, but for now, this is really only for traumatic hemorrhage within 3 hours. For pediatric dosing, this does vary significantly, so make sure you look at your protocols for this, but this is starting to be incorporated into pre-hospital guidelines as well. Usually 20 to 25 mg per kg, somewhere in there is your pediatric dosing, but again, go ahead and refer to your guidelines.